Hey, we're going to talk fertility with Dr. Shaun Tregoning. He's in the Olive Fertility Clinic out in the Surrey area. And Shaun has an interesting background. He's originally from South Africa, trained in South Africa. So he's got his medical doctor training from South Africa, OBGYN. You did your reproductive endocrinology and fertility, I believe, in South Africa and also in the States. Is that correct?
That's correct, yes.
And today I wanted to talk to you just kind of, there's the typical traditional IVF, and Olive is doing a great job of offering that here in the Vancouver area. We love integrating with you guys. But I was pleasantly surprised that you're doing homeopathy, you're doing some PRP as well for uterine receptivity, and you're also big on diet and IV therapy. What is your background when it comes to homeopathy, and how are you recommending or incorporating homeopathy in optimizing fertility and uterine receptivity to start with?
Sure, that's a good question. I guess the short answer to that is that my general interest in medicine from the beginning is to always have had a more integrative approach. I've never truly believed that there is a one-size-fits-all approach to healing people. I strongly believe that the human body was designed in an ideal world to heal itself, and that as various different practitioners of healing modalities, we often just help kick the body in the direction it naturally wants to take. And so if you have that as a guiding philosophy, then you have to embrace that what we do as allopathic physicians, which is very interventive with high dose pharmacotherapy drugs, certainly is effective. But alongside that, there are other strategies that allow the body to do its own thing, and so I like to embrace that. So because that was my interest, I landed up doing a diploma in what's called clinical homeopathy, and which is an 18-month course that anybody from a medical nursing background can get into, sort of more hardcore allopathic people. And it's taught really by homeopathists that try to combine traditional allopathic medicine and homeopathy into one. And so from that, the principles of homeopathy are very different, because we don't treat diseases in homeopathy, you treat patients. And so one prescription for you might not be the same as you give to somebody else, because you look at the constitutional changes and effects in people. And so I've kind of tried to integrate that a lot with my patients, where they're open to that as an adjunctive to what we do traditionally.
And I know it's not a stretch for you, because in South Africa, homeopathy is a very common thing in the medical practices, and the public is very unfamiliar with it already.
That's right. As is throughout most of Europe. So homeopathy in France, which is sort of like the birthplace of where the early big homeopathy practitioners from Germany and France emanated from there. And so the Europeans have a pretty open approach, and certainly there's a fairly open approach when I was a kid growing up towards homeopathy as well. So I didn't enter into it with this antipathy or this idea that it was something very fringe or weird. It doesn't deserve, or it doesn't get or enjoy a lot of support in North America as a viable option. However, take it for what it is. Those of us who practice it have usually used it on ourselves and noticed a difference. And for people who are open to this, it certainly, I have seen profound effects, particularly in our specialty area, where we're dealing with IVF and can often run into the trouble of having patients who develop a condition called ovarian hyperstimulation syndrome, where you can actually overstimulate the ovaries, and you can actually become quite ill from this. And there are a few homeopathic drugs that are very effective in this situation to try and dampen down that effect. So,
it was a pleasure when I'm over in Olive in Surrey. You got your prescription drugs there, your pharmacy, and you have homeopathy there. And I love how you integrate, and that's probably why the patients really enjoy seeing you, because your philosophy is similar to at Acubalance, Chinese medicine, naturopathy, functional medicine. The body has an innate ability to heal. Can we support it, right? And
that's exactly right.
And so we share that common paradigm idea. And it's nice that you're training both. I got to remind the listeners that Dr. Shaun Tregoning here is an MD, OBGYN, also has his fellowship in reproductive endocrinology and fertility. and he's done homeopathy training. So it's just nice to see. You're what I call, Shaun, Dr. 2.0. You see, when I started back in 2000, integration was there's me doing the non-conventional allopathic medicine, and then I'd work with a reproductive endocrinologist. But you're what I call the future of medicine. You're Dr. 2.0 because you're trained in both. So that's really nice. Now, also PRP, I have patients asking me about PRP, and I know you're doing PRP, and there's people in the States, I don't think it's happening in Canada so much, doing PRP in the ovaries. You're doing, I believe, PRP for uterine receptivity. Can you explain kind of what PRP is, how it can benefit the women, and what's going on with ovary PRP in Canada versus the States as well?
Sure. So, I mean, PRP's history dates back, I do believe, to about 1975. So it's a term meaning platelet-rich plasma, and was actually coined by hematologists, not surprisingly enough. And it defines, within our blood system, there's three big cells: the white blood cells that fight infection, the red blood cells that carry oxygen, and the platelets that are really responsible for allowing coagulation to happen. And people thought for a long time that that was the only function of platelets, was to coagulate your blood if you have a cut. Until people started discovering that platelets have multiple granules in them. And the type 3 granules, which are probably the most prolific, are the ones that actually contain growth factors and cytokines. And so it started off really with sports medicine physicians and orthopedic surgeons who did a lot of joint stuff, injecting PRP into joints because they found it had a restorative and healing property. Maxillofacial surgeons and dentists would then came on board because they used PRF, or platelet-rich fibers, to allow coagulation of deep sockets in the mouth. And then it spread into aesthetic medicine and plastic surgery, where it's now been shown to be very, very beneficial for skin rejuvenation. So when it comes to fertility, it doesn't matter where you use PRP, the logic behind why you'd use it is the same. And in the setting of fertility, there's really three big areas where there have been some studies and some still ongoing. And the one is when you fail to get the uterus lining to thicken up in a patient who's undergoing a frozen embryo transfer. So these are women who would have had IVF, have embryos frozen, and then we prepare the uterus lining to receive the embryo. And in some cases, we struggle with traditional hormone therapy to actually get the uterus lining to thicken up. And one of the strategies there is to use PRP, taking into account the idea that it will stimulate the body's own growth factors and help to allow the hormones to be permissive to do their role. The other sort of closely related to that is in women who've had multiple failed implantations of an embryo, where again, if you're putting in the body's natural growth factors, stimulating all the factors that might be necessary to allow the embryo to attach to the wall may improve the chance of a subsequent embryo transfer being successful. And then what you were alluding to earlier, the ovaries, this is sort of a term that's now coined as ovarian rejuvenation. And this would really be for women who have diminished egg reserve, which is very difficult. We know physiologically women's egg reserve is sort of genetically predetermined before a girl is even born. About 17 weeks of intrauterine life, the fetus will already have all the eggs it's going to have forever, and from there on begin losing. So there's not a whole lot you can do to fight genetics. You can't change your height with medication because that's genetically determined. You can't change your egg number. But what you can do is try to rejuvenate the primordial eggs that are there. So the feel is that there are some, even in women who've lost their egg capacity, there may be some primordial eggs that if you get to them early enough with rescue therapy, they might be able to take off and become viable eggs to use for an IVF cycle, for example. So in New York at the moment, there are a couple of clinics that do a lot of ovarian PRP. There's quite a few clinics in Cyprus and Greece that do them, and then a few clinics in Israel. And these are the only three places where PRP in the ovary is used fairly ubiquitously. In Canada, it's not really a big thing. It's just never taken off. And I guess the reason is because there's not really good published scientific data on its use. However, we may see that change over time as more and more patients get enrolled into studies. But certainly when you've got your back against the wall and you have nothing to lose, the intervention is not dangerous. We just take PRP and inject it into the ovary.
And it's interesting, you mentioned the PRP and the rejuvenation, how it started a lot in the orthopedic and sport world. The same thing with photobiomodulation, low-level laser therapy, and they have been showing, this may be of interest to you, when you do the photobiomodulation and you're doing the PRP, so in that same week, it enhances the impact, the PRP effect, and that's why at Acubalance we're using photobiomodulation, low-level laser therapy for that same idea. Can we reach the primordial follicles to rejuvenate the mitochondrial function to help improve the egg quality, which turns into the embryo quality?
Right.
So maybe something we'll be doing more integration with in the future with you on that.
That's absolutely right, and I mean it would certainly be a really interesting study in the future to do. Is once we've now finally settled the score that PRP does help, maybe not for everybody, but for some people, and we've got to figure out what that subgroup is to look at a combination of therapy with PRP combined with photobiomodulation and look at the synergistic effects. Just like we know, this is why we have a low threshold to send patients to Acubalance, because of the whole integrative approach that the patient is then allowed to embrace. Us as mainly doing the allopathic hardcore medication stuff, and people in your clinic, doing the naturopathic and traditional Chinese medicine approach. As I always say to patients who really have a poor prognosis because of low egg reserve anyway, you never know when that one little tweak is the difference between a baby or no baby. And so even in traditional scientific studies that are published, we say something shows no efficacy. It's kind of arrogant to say that, because we're saying that there's no efficacy set to the parameters we've decided up front defines efficacy. And we usually use traditionally in scientific papers a 5% cutoff. But if you're a person who has nothing to lose, and I say to you, there's a 0.1% chance that this innocuous intervention might improve your outcome, you may say, if it doesn't cost me much and it's not going to harm me, throw everything in the world at me. And I think there's not enough of that thought process around, I guess, what one calls the patient's individual point of equipoise, the point around which every individual will accept risk and benefit for themselves, as opposed to being didactically told there's no evidence. It's just in every scientific study, there's an outlier on a graph, and you never know when you're it. So even from a scientific point of view, there would be a rationale for doing it.
Dr. Shaun Tregoning, I want to thank you for these clinical pearls. It's nice to hear about you doing the integration. Again, we love that you're open and integrating, referring people for acupuncture, the laser therapy, and IV therapy, and that you're offering the homeopathy to your patients and all the other counseling you do along with the PRP to help optimize their fertility. And so it's a pleasure to be integrating with you, and thanks for letting more of the men and women know what's available to them with respect to homeopathy and PRP. And to check or find out or get a consult with Dr. Shaun Tregoning, you can go to his website, olivefertility.com, and he's in the Surrey, British Columbia location. Take care, Shaun, and thank you.
Thank you very much.